wash your hands and wear face masks have become mantras for billions of people across the globe. But what if you don't have access to clean water? How can you be expected to wash your hands frequently? And what if a paper mask is essentially a luxury for you? That's the case in the Navajo Nation, home to more than 173,000 Native Americans. The territory spans part of Utah, New Mexico, and Arizona. About 40% of its residents don't have running water, and they have been hard hit by COVID-19. The Navajo Nation has surpassed New York and New Jersey for the highest per capita coronavirus infection rate in the US.
It's just shedding light on the disparities that have already existed, and also the lack of federal funding to meet the demand of the health needs.
The US Congress allocated $8 billion of relief to Native American communities as part of its response to the pandemic, but tribes had to sue the Treasury Department to access the funds. In Canada, the government pledged to spend $216 million to protect First Nations and Inuit communities. That amounted to just $142 per person. The funding also doesn't go to Indigenous people living outside Indigenous reserves. They make up more than half of Canada's Indigenous population. But after pressure from the First Nations Council, the funding was increased nominally. Experts believe these populations are more vulnerable to contracting the virus because of overcrowded housing, inadequate health services, malnutrition, and lack of clean water. According to some estimates, 90% of native population of the Americas was wiped out by disease after the arrival of the first Europeans. And there's fear as any new disease could devastate these communities again. Paulinho Payakan, a leader of the Kayapo people in Brazil and a well-known defender of the Amazon rainforest, died from COVID-19 last month.
Although COVID-19 is a risk for all indigenous peoples globally, WHO is deeply concerned about the impact of the virus on indigenous peoples in the Americas, which remains the current epicenter of the pandemic. As of the 6th of July, more than 70,000 cases have been reported among indigenous peoples in the Americas and more than 2,000 deaths.
While COVID-19 has hit Brazil's indigenous communities hard, President Jair Bolsonaro has dismissed the virus as a little flu and has been accused of encouraging loggers and farmers to move into indigenous reserves. Many indigenous advocates fear this land grab could take place while the world is focused on the pandemic. In other parts of the world, the remoteness and isolation of indigenous communities have been a benefit. In Australia, they have been less affected by the virus than anticipated. Indigenous-run health services ensured that public health messages were culturally sensitive and communicated in local languages. But still, Indigenous Australians are 16 times more likely to be living in overcrowded housing than other Australians. So an outbreak would spread faster and could be more deadly. Health officials warn this pandemic isn't over. They also say Indigenous communities are particularly vulnerable.
I'm very worried because our population of Native Americans are very low, and if this continues on, the numbers are going to drop even more.
So for some indigenous communities, this is yet another moment when their survival is under threat.